Rare diseases. What is a rare disease? A disease or disorder is defined as rare in Europe when it affects fewer than 1 in 2,000. In the USA, it's the one that affects less than 200,000 people in the United States, or about 1 in 1,500 people. It's important to know that 80% of these illnesses have identified genetic origins, whilst others as the result of infection, allergies, and environmental causes. They can also be degenerative and proliferative. What is more, 50% of rare diseases touch children. So, I'm going to speak about 3 different rare diseases that I consider very interesting: Marfan syndrome, Möbius syndrome, and the congenital insensitivity to pain, CIP. Marfan syndrome. What is Marfan syndrome? Marfan syndrome is a genetic disorder that affects the body's connective tissue, that holds all the body's structures and helps the body grow and develop properly. That is why this disorder affects many different parts of the body, but it does not affect intelligence. Who has Marfan syndrome? About 1 in 5,000 people have this syndrome, and about 3 out of 4 of these people inherit it. How is Marfan syndrome caused? Marfan syndrome is caused by a mutation in the gene that determines the structure of fibrin 1, a protein that is an important part of connective tissue. What are the symptoms of Marfan syndrome? The body system most often affected by Marfan syndrome are the skeleton, the eyes, the cardiovascular system, the nervous system, and the skin. That is the reason why people with this disorder are very tall, slender, or loose-jointed. More than half of all people with Marfan syndrome experience dislocation of one or both lenses of the eye. They are prone to suffer aorta rupture, and they are also prone to suffer pain, numbness, or weakness in the legs. Many people with Marfan syndrome also develop stretch marks. What treatment options are available for Marfan syndrome? There is no cure for Marfan syndrome. The only option are treatments which can minimize and even prevent complications. Moebius syndrome. What is Moebius syndrome? Moebius syndrome is a rare neurological disorder that is present at birth. It primarily affects the 6th and 7th cranial nerves, leaving those with the condition unable to express their faces and move their eyes laterally. Who has Moebius syndrome and how is it caused? Some researchers estimate that the condition affects 1 in 50,000 to 1 in 500,000 newborns, and most of cases of this syndrome are sporadic. What are the symptoms of Moebius syndrome? The symptoms of Moebius syndrome are related to head function, weakness, and deformities. Some of them are lack of facial expression and inability to smile, feeding problems, drooling, strabismus, short or deformed tongue, dental problem, hearing impairment, speech disorders, and club feet. What treatment options are available for Moebius syndrome? There is no cure for Moebius syndrome. The only option is treating the symptoms with therapy and surgery. In addition, plastic surgery could provide an ability to smile. Congenital insensitivity to pain, CIP. What is CIP? CIP is basically the inability to feel pain because peripheral nervous system is affected. This lack of pain awareness often leads to an accumulation of wounds, bruises, broken bones, and other health issues that may go undetected. People with CIP lead to be a reduced life expectancy, as children with the disease tends to injure themselves because the lack of pain awareness. Who has CIP and how is it caused? About 100 cases of CIP are researched in the USA, and there are more than 300 cases in Japan, because the disease is more common in genetically homogeneous societies. CIP is caused by a genetic mutation which prevents the formation of nerve cells, which are responsible for transmitting signals of pain, heat, and cold to the brain. What are the symptoms of CIP? When a person has CIP, it could be appreciated some different symptoms as frequent physical injuries, lack of pain sensation, lack of awareness of physical danger, oral damage, or fractured bones. What treatment options are available for CIP? Unfortunately, there is no cure for CIP. However, treatment is most commonly in the form of early education of relatives and the patient in later years. Pharmaceutically, naloxone is used to prevent inactivation of neurons to receive pain signals. We have seen, it seems to be that there is no cure for most of rare diseases. This fact leads us to the following question. What is the reason for this lack of treatment? The answer is very simple. The percentage of affected people is very small, and these diseases are nowadays impossible to treat since most of them are genetical and there is no way to cure genetical disorders after birth. Maybe someday it could be possible to cure most of these diseases. Let's hope it will happen.